Welcome back. Our Ask an Expert today, Dr. Alan Boroditsky, a podiatrist. Thank you so much for being here.
It's my pleasure.
Now we're heading into running season. Lots of people, now that there's no snow on the ground, are out thinking about at least getting out and getting into the running season. And we keep hearing these sort of horror stories of people who are, and I'm not talking elite athletes, I'm talking, you know, the Joe Blow out there trying to be a runner, who lose their toenails. What is that all about, and what can we do to stop it?
That's probably the worst thing that happens. And it doesn't just happen in running, it happens in skiing and all sorts of winter sport activities that it's done. And usually what happens is the nail loosens from the nail plate, and it's kind of stuck down with some small vessels and what have you. And when those nail tears off the nail plate, those vessels break and you bleed, and you see that black under the nail. Well, the new nail has nowhere to grow into, and what happens is it eventually butts up against this old nail, and the old nail falls off and the new nail comes in. But if the nail root is damaged in that area, it may come in wavy and really kind of bent and all sorts of kind of ugly nail problems that patients have. So the trick really is to get it treated early, because sometimes we will drain the blood out of the nail, or sometimes even remove the nail to allow the new nail to grow in. So seeing someone early is important. Hiding that nail under gel nail polish or something, not knowing about it is a problem. So we talked a bit about that. So identifying the problem early makes a big difference, because once that nail root is damaged, it's a permanent thing.
And are you actually waiting for the nail to grow from the nail bed out, or does the nail bed somehow transform into?
It's a little bit of both.
Oh, okay.
Yeah, and what happens also when it doesn't cleanly adhere back down to the nail bed, it's also an entry point for infection, the most common being a fungal infection. So you could be the lucky one with a dystrophic or an abnormally growing nail that is not only abnormally growing, but now introduces fungus. So you may come and we treat the fungus, but the nail can still grow funny.
So what do you do if you've got one of those wonky nails? Can you fix it, or does it eventually grow into a normal looking nail?
It does not eventually grow into normal, and that's the point. So if you have a fungal nail infection, you come in, we will culture it and sample it, identify the fungus and treat it. That nail will grow into a normal nail again, hopefully. If you have a damaged nail, that nail can't be treated with medication. It could be manicured or pedicured or cleaned up to be somewhat less of a bother, but it will never grow back normally, and that's a problem. So some people, you know, will just come in on a regular basis and clean it up. Others may choose to have the nail removed. I had a patient not too long ago that works in construction. His nail is very thick, very damaged, and the steel toe boot really bothered him. His choice was to remove the nail. So we remove the nail, we destroy the root, no nail grows there. You'll get kind of a thin film of rough skin over there, but he's extremely happy now. His toe doesn't kill him every day. So for some people that's a good decision, and others it's not. It really depends.
Okay. We do have a caller on the line, Diane from Cranbrook this morning. Good morning, Diane.
Good morning.
What's your question for Dr. Allen?
My husband has what they call bear claws for his toenails, and they are very hard to cut or anything else. I was wondering if you could give us some ideas how to treat them.
Like really thick toenails, you mean?
Oh, yeah. They call them, the doctor says they're called bear nails. You can't cut them with clippers. You can't cut them with scissors.
Wow.
He uses wire clippers sometimes.
Okay. Well, I mean, I'm assuming what that means is, I haven't heard the term bear nails, but I think what we're talking about is really thick, difficult to cut nails, which can be a combination of trauma and infection. So these nails are extremely difficult to cut. Usually they need professional care to cut them. So I'd recommend seeing if there's a podiatrist locally that can treat it, and also identifying what the reason is. Is it an infection? Quite possibly can be, and he may be a good candidate for oral medication.
Okay.
So that's the first thing I would recommend. And don't do any kind of wire clippers that aren't sterile, because you can introduce some pretty serious infection into that area.
Yikes. All right. Good luck, Diane. Thanks for calling. Sharon is on the line from Penticton. Good morning, Sharon.
Good morning. How are you?
Very well, thanks. What's your question for Dr. Allen?
Yes, I've got a little bit of plantar fasciitis in one of my feet, actually both of them. A lot of the pain has been a bit in the ball of my feet, but I'm just wondering, how long do I have to stay away from aerobic activity before I can get back into treadmill, walking, that type of thing?
That's a really good question. Plantar fasciitis traditionally is pain in the heel. but can cause, over a long period of time, pain to be elsewhere because of compensation. So if your heel hurts, you tend to walk more on the ball of the foot and expands. The plantar fascia, plantar means the bottom of the foot, like plantar's wart, so plantar refers to location. Fascia is a thick band of tissue, and it originates on the heel and expands to the ball of the foot. So, you know, every step you take is almost a re-injury. So treatment of this is really important. It's hard to move forward with weight-bearing activities such as a treadmill without treating it, because you're just going to exacerbate the symptoms. So I'd recommend treatment and also a diagnosis, because it's not always plantar fasciitis that you have. You know, you could have a stress fracture, for example, of your heel that can cause similar pain. You can have a pinched nerve that can be causing similar pain. So diagnosing it is really important before proceeding with activities.
And really quickly, I had a message on my Facebook page today when I talked about you coming in asking about heel spurs and Achilles tendon pain. Is there a connection between them, and what's the best way to treat them?
Great question. So a heel spur is the result of chronic plantar fasciitis. The fascia tearing off of the bone causes a micro tear, and the body responds by laying down new bone in that area. When someone's all better and doesn't have heel pain anymore, they still have their heel spur. Many people have heel spurs or traction spurs all over their body without pain. So this heel spur is not what hurts, it's the fascia tearing off. So identifying that and treating that is important. The Achilles tendon is related also because of the strong pull of the gastrocnemius, or the calf muscles that are pulling up in there, and they can also cause spurring in the back as well. The back of the heel having a spur is a little more problematic because it tends to rub in shoes. There's not a lot of fat that sits over that area. So stretching the calf muscles is really important for the Achilles, the tendonitis, but also for fasciitis as well. Makes a big difference.
Great answer. Thank you so much for coming in. If you have more questions for Dr. Allen, you can check out his website, alliedfootspecialist.com, or give him a call, 604-878-FEET. Next week, or if you have a question for any of our Ask an Experts, email us, weekendnews@globaltv.com.